Hello, welcome to my channel, our fertility place. Okay, so in today's video I will be talking about letrozole for fertility. What you need to know about letrozole for fertility. You know, if you are trying to conceive, you know that the journey is stressful. It is frustrating, confusing, heartbreaking, and emotionally draining. Fortunately, modern medicine has given us many tools to use like it is gynecologists uses this some of these tools to help couples grow their families, and one of them is the one I discussed the last time, myomectomy, where I shared in my story that it increases my chances of conceiving after trying again 6 months later. So in today's video I will be talking about another tool, which is letrozole. So I'll be talking about how it works for fertility, what to consider while using it, and probably share reasons why it may work for you. But before I go into today's story, I would like you to subscribe to this channel if you have not, and then put on the notification bell so that you can be notified whenever I drop my new videos. So stick with me as I go into today's story. Welcome back. So getting pregnant with letrozole. What is letrozole? Letrozole is an aromatase inhibitor. Okay, your body produces aromatase and it helps in the synthesis of estrogen. So it encourages the production of estrogen in your body. However, if you have this aromatase substance produced excessively in your body, it also encourage the excess production of estrogen, and when you are producing excess estrogen, you discover that you are going to be producing immature eggs. So now this, what letrozole does is that it suppresses or lowers the production of this substance called aromatase aromatase in your body, and then decreases the production of estrogen. And when this is done, it now encourages the hormone that encourage ovulation, which is follicle stimulating hormones. And when this is produced, it helps in your body to produce mature eggs. It helps your body to ovulate effortlessly. Okay, so that is what essentially what letrozole does, and that is why it is used for fertility, to improve fertility. So now this letrozole is not used for everybody. Okay, letrozole, since it works with aromatase inhibition and lowering of estrogen, it is used for patients living with polycystic ovarian syndrome, because that syndrome is being encouraged by excessive estrogen. Okay, so if you are having PCOS, or if you are having ovulation disorder, if you are not ovulating well, and if you are having unexplained fertility, your gynecologist can recommend letrozole for you, and then to explore it and see if it's going to work, okay, for you. Now you see, that is why it is very important for you to work with your gynecologist and not self-medicate, because many women actually listen to success stories, and then when somebody shared that letrozole worked for me, I conceived after using letrozole, they will also want to go and try. But all these tools actually work when it is tailored into your complication, when it is tailored into your medical history, when it is tailored towards your test result. Okay, so gynecologists don't just recommend letrozole, they actually put many things in place and then see if this is the right choice for you. If it is not the right choice for you, they will recommend something else. So letrozole is basically used, gynecologists use this for patients that are having PCOS, that is polycystic ovarian syndrome, or those ones that are having ovulation dysfunction, or those ones that are having unexplained infertility, that is they have tested everything and nothing is showing that this is the root cause of their infertility. So gynecologists actually recommended that for them. Okay, so that is why many of those stories that you hear, that some people are testifying that this worked for me after using it, is because that is the reason for their infertility, and when they used it they became successful, they conceive after using it. And also this may not work for you if the cause of your infertility is not just ovulation dysfunction or PCOS. Okay, if you have other complications like tuber issues, that is fallopian tube issue, and so on and so on and so forth, or maybe if your husband is the one that is having issues, you may see that when you use it, it may not bring forth result for you. So it is very important for you to work with your gynecologist, so that by the time this is the right option for you, definitely is going to increase your chances of conceiving, and then you may get results afterwards. So the letrozole is actually successful. Many people have used it and it has been successful. So if you can also get to see your gynecologist and tell him about using letrozole, and he may consider it after checking your results, and then you may find it helpful after everything. So if you find this very relieving for you, please subscribe to this channel and then watch out for my next video. Then I will talk about another tools that can be used to improve conception. See you.